Today we're going to do a general in-service on an oxygen concentrator. An oxygen concentrator filters oxygen from the room and delivers it to the patient at high levels or high concentrations, similar to what's in bottled oxygen. So if you're using an oxygen concentrator, you can be assured that you're getting medical grade oxygen to the patient. The advantage of a concentrator is that it is much safer, much more efficient way to deliver it. Don't have to worry about refilling bottles or anything like that. So it's the best and most efficient and safest way to deliver oxygen to a home setting. The first thing you need to do when you're setting up an oxygen concentrator is find out where you're going to put the concentrator. An oxygen concentrator always works best the closest it is to the patient. You want to make sure you're close to the patient if you're going to deliver this. If the patient was sitting in this chair, this would be a good place to put it. Secondarily, if you're working in an area that has hardwood floors like this one or a tile floor, the vibration can cause excessive noise, or at least more noise than you want to provide. If you are working with a hardwood floor, if it's not on a carpet, then try to find a rug like the one that we have here to go underneath the concentrator. That will eliminate, or it will at least reduce some of the noise levels. So now we've got it set. We're in a good position here in relation to the patient. We've got it set on a rug underneath to eliminate some of the noise. You need to make sure you have at least 3 inches of room all the way around the concentrator. As we have here, this is a good setting. It's not up against any drapes or linens that can go against the filters and occlude them and cause the unit to run much hotter. There's nothing around here that's a heat source like a fireplace or something like that that can also add to the unit heating up and running less efficiently. So this is a good area right here to set it up. So what we're going to do is, the first thing we're going to do is plug the unit in. Remember that the unit should always be plugged directly into a wall socket as it is here. You should not plug it into an extension cord. That's something that is prohibited by the manufacturer. Okay, so we're all set. We're plugged in, we're ready to go. So the next thing I'm going to show you is the face of the unit and what each one of those things does. Okay, this is the face of the oxygen concentrator. This is where all the functions are handled from. So I'm going to go over all of these items on here and show you what each one does. Let's start with this one down here. This is the hour meter. This is actually something that you shouldn't be concerned with. The hour meter is something that we use when we're doing preventative maintenance or when there are certain maintenance issues that need to come up. We monitor the hours and we take care of them on an hourly basis, similar to what you would do in servicing your car. This switch right here, this is the on-off switch. I'm going to turn this on in just a second. The on-off switch is a rocker arm, so it's very easy to work with. If you push where the I is, you push it down, that turns the unit on. If you push where the 0 is, that turns it off. To the side here is the surge protector, or essentially it's a surge protector. What this does is, if there's a power surge to the house, this little button, which sticks out about 1/8 of an inch, will pop out. The unit will shut off and the alarm will sound. You're going to hear the alarm in just a second. When this button pops out, let's say you're in the house and you know there's been a power surge and you know that the lights have dimmed or the lights have gone out. You go into the room, you see that the concentrator is not working, this button has popped out. You need to handle it in this sequence. First thing you need to do is to shut the unit off. Then you need to push the button back into the reset area. Then turn the unit back to the on position and it should reset and continue resuming normal operations. If it doesn't, you can give us a call. You can see that we have a sticker here. There's actually a sticker in the front of the unit also. There are numbers on each piece of literature that we leave for you. So it should be very easy for you to get a hold of us in case of an emergency. We do have 24-hour servicing. So now I'm going to turn the unit on. When I turn the unit on, you will notice that the ball inside the flow meter will start to rise. That beeping was the alarm. That's what you will hear also if there's a power outage or a power surge. Okay, so we've moved it to the on position, and you see that the ball has started to rise inside the flow meter. The way that we change the flow for the meter, and right now it's set at about 2 liters, is with this knob here. When you turn it, you can see the ball going up and down in the flow meter. What you want to do is position the ball so that it intersects the line wherever you want the flow to be set. So if it's at 2 liters, the line at 2 should intersect the ball right in half. This setting should not be changed unless a nurse or a doctor approves of it. Patients should not change it at their convenience or what they think is better for the patient. Oxygen is a therapy. It is provided by a doctor's prescription, and it should not be changed the same way that you wouldn't change your medication to the patient. The oxygen actually comes out right here. As you can see, as I cover it, the ball goes down in the meter. This is where the oxygen comes out, so this is where you need to hook up your connections, which is the next thing that we're going to go over. So as we proceed from here, we will now go over the connections to the patient and the tubing that goes along with it. Okay, now we're going to go over connections and tubing. The simplest way to provide oxygen to the patient is via a nasal cannula, which is what I'm holding here in my hand. A nasal cannula comes with 7 feet of tubing with it. It has one end that you can see that connects to the nipple on the concentrator, which is the place that we showed you where the oxygen comes out. The other area has 2 extensions, 2 prongs which go into the nose. I know it's hard to see from there, but they curve either up or down. They should curve down into the nose, like this, into the nose, not up into the nose. So the first thing we're going to do is we're going to connect this to the concentrator. So basically, you just press it onto the nipple until it goes on completely. Then, if you were going to put this on the patient, you would position the prongs so that, again, they're curved down. They would go into the nose. Then you take the tubing to the side and you bring it up around the ears. Everything with the tubing, the nasal cannula, always stays in front. Then on the front of the nasal cannula here is sort of like a bolo tie where you just cinch it up to keep it in place. So everything always stays in front. Okay? This is a nasal cannula. This is the easiest way and the most common way of providing oxygen to the patient. An oxygen nasal cannula like this is always provided from 1 to 4 liters. When you get above 4 liters, there are other options. One of the options is a mask, an oxygen mask. The oxygen mask also has 2 ends. One is the same as the end that hooks into the concentrator, so you would hook that on the concentrator the same way. Then the mask itself has some pull straps on it. You can loosen them up. It goes over the head of the patient. Then you can pinch it at the nose to keep it more in place, and it just goes on that way and they continue to breathe. Again, a mask should not be used unless you get at least 4 liters to the patient. Some places will even say higher. We do have high flow nasal cannulas, but an oxygen mask is available for patients in excess of 4 liters. Now sometimes you need to provide humidification, especially at high flows. I'm going to ask that you not provide humidification if the patient is not using oxygen continuously, because you should not allow water to sit in a container even like this for a significant amount of time. But if the patient's using higher flows and they have discomfort in the nose, you need to provide a humidifier bottle. This is a humidifier bottle that we provide in the home setting. This is a reusable humidifier bottle. This humidifier bottle should be used only with distilled water. Now, if you're first setting up and you want to use tap water the first time, then we do allow people to do that. But for extended use, you should use distilled water only. On the bottle, there are 2 lines. The upper line says maximum, the lower line says minimum. The maximum line is very important. Do not fill past the maximum line. The minimum line is more of a guide. A patient can go for a while without humidification, but the maximum line is there to prevent you from overfilling the bottle, which can cause the water to go back down the line into the unit, and it will absorb into the filter inside and shut the unit down and make it so it's not working. So please do not fill past the maximum line. The way this humidifier bottle works is you have a piece of tubing here. This tubing connects to the top of with the black connector to the top of the humidifier bottle. Then the other side of the tubing hooks onto the concentrator. So if you're using a nasal cannula, as we have hooked up here, and you need humidification, first thing you do is disconnect the nasal cannula from the unit. Then you take this length of tubing, and by the way, sometimes this length of tubing, if it's not put on the back because they're not using it right at that time, or if it's not hooked to the bottle, and the bottle's sitting in here, will be in a compartment here on the side of the concentrator. You can open that up with a coin or with a screwdriver, and sometimes it'll be sitting in there. So you take the black connector, you hook it to the top, and you screw it on, making sure that it's tight. Then the humidifier bottle, what you'll do is unscrew the top, and you'll fill it, not filling again past the maximum line. Now this is the biggest problem that we have with concentrators, is after they've filled this bottle and they're putting the lid back on, they don't get the lid on square and tight, so there's leakage around here, and then it appears that there's no oxygen going to the patient. So when you're doing this, make sure that after you filled it, that you get this lid back on square and tight, and look at it and make sure that it is even around there, that it's not sitting sort of cockeyed, okay? So you fill this, now this sits in this holder, and then your tubing connects to where the nasal cannula used to be. Now on the face of the humidifier bottle, there's a nipple here that looks pretty much like the one from the concentrator. That's where you then hook up your nasal cannula or your mask, however you're going to provide it. When you do that with the unit on, what it's going to look like, it's going to look like the water is boiling, because the oxygen is going down and it's roiling the water, and then the little droplets of humidification are going through and adding moisture to the line. This will help alleviate some of the discomfort that patients feel when they're using oxygen, if they have discomfort around the nose area. Okay? Now sometimes you have patients who are more mobile. And one of the things we try to do is we try to maintain patients' dignity as much as possible. One of the ways to do that is if a patient is on oxygen continuously and they need to get up and use the restroom, or they would like to get up and sit in a chair, you want to allow them to do that and making it as easy on them as possible. So one of the ways to do it is by providing extra tubing or an extra length of tubing so the patient can get up and move around. We have tubing that comes in two lengths. There's 20-foot length, which is what this one is, and 50-foot length. 50 feet is the maximum you can provide to a patient according to the manufacturer's guidelines. When you provide 50 feet of tubing, you're actually also losing about 1 liter of flow. So if you have the patient on 4 liters of oxygen and you have them on 50 feet of tubing, where the oxygen is coming to the patient, they're actually only getting 3 liters. So you need to keep that in mind. 20 feet of tubing is not a huge deal. With the extended tubing, you have 2 ends that look just like the one that connects either to the bottle or to the concentrator. So if you're going to hook this up to allow the patient to move around, the first thing you need to do is disconnect the nasal cannula again, or the mask, and then you have to have a way that you can connect these two together. Obviously, since the ends are the same, they're not going to hook into each other. So there's a little piece called a connector that has 2 male ends on it. One of the male ends goes into one end of the extended tubing, and the other end goes into your nasal cannula or mask. Then the opposite end of the extended tubing then hooks on to the humidifier bottle or to the concentrator. And in this way, now as you can see, your patient is able to put the nasal cannula on and walk around the room or go to the restroom if they need to do that, or maintain a little bit more of the dignity that we're trying to do here for our patients. One thing I do want to warn you on is I'm going to ask you not to provide extended tubing because of the sound of the unit disturbing the patient. This is a therapy. If you're in an ICU, there are bells and whistles going off all the time, but you wouldn't remove those pieces of equipment from the patient's room. Again, remember, this piece of equipment works best the closest it is to the patient. It's most efficient when you're using it only with the 7 feet of tubing with the nasal cannula or mask. However, if you do need to provide it with the 20 feet because you're trying to do other things as far as dignity or helping the patient to stay active as long as possible, then it is possible that we can provide that tubing, but not further than 50 feet. Okay? So right now what we've gone over is we've gone over the connections, which include to the patient delivering with a nasal cannula or a mask. We've gone over hooking up the humidifier bottle with the piece of tubing that connects to the unit. We've gone over hooking up extended tubing. Couple things real quick about this again to go over some of the problems that you're going to encounter with these types of things. Number one, as we've gone over, is the humidifier bottle. Make sure it's on square and tight. Do not fill past the maximum level. Another thing you're going to experience is with the extended tubing, you need to make sure that it's set up so that it's not going to be a hazard as far as tripping or anything like that. Another issue with extended tubing is with humidification, if you're using that, the water is going to build up in the line of the extended tubing. There's no way to avoid it. The longer the tubing, the more water will build up. If you get in a situation where you notice there's a lot of water in the line, there are two options. One is to place another extended tubing along there and just hook it up the same way. But a secondary option is to bypass the humidifier bottle. And the way you do that is you disconnect the humidifier bottle from the concentrator, disconnect the extended tubing from the humidifier bottle, and hook it directly onto the unit, onto the concentrator. When you do this, there's still water in the line. If you run it that way for 24 hours, it will dry out the water in the line, and then you can go back to hooking it up the way it was before. Okay? Next thing that we'll go over with these units are other safety issues. Okay, just a couple things to remind you of when you're dealing with oxygen in a home. Number one, oxygen should never be placed around a heat source, an extensive heat source. Oxygen itself is not flammable, but it will make a flame a lot higher. So you want to keep it away from stoves or fireplaces or anything like that. Remember that a concentrator is the safest way to provide it because it is drawing air from the room and is not saturating the room in oxygen. However, you should keep it away from external heat sources. About once a week, there are two filters on the sides. You can see them here and here. These should be checked. They will collect lint over time. The best way to clean them is just to pull them out of the sides, take them outside, rub them together like this, get most of the lint off. Some people will tell you to wash these with soap and water. The problem with doing that is if you don't get the lint off first, the lint will embed in the filter and then it will actually impede the flow more. So my suggestion is just to take it outside, rub them together until you can see through it, you see most of the lint is off, then just bring it back and just fit it back in the way it was before. I don't like to use soap and water or anything detergent to clean these units because I don't like to advise people to use any type of moisture with an electrical device. Even though the risk of having electrocution is minimal, anytime we can eliminate that even more, that's what we're going to do. So don't use any water to wipe it off. Don't put anything underneath it. Again, this is mobile. You can roll it around, so if you do need to put it in another position, you can do that. Do not hook it up to an extension cord. Lastly, and I think this is one of the most important things, you see a sticker on here. This sticker says no smoking. On the information, and when we in-service, we tell people no smoking. It is important to not smoke when you're around a device like this. Oxygen, as I said again, is not flammable, but if you are smoking and if you get that smoke close to the oxygen coming out of a nasal cannula, it can be a bigger problem than it needs to be. So please, no smoking within 100 feet of this unit. Next, we're going to move on to the portable unit in case of power failure or in case you need to move around. When we deliver an oxygen concentrator to a house, it is an electrical device and it doesn't have a power backup. So one of the things that we need to do is we need to provide oxygen in case there's a power outage or in case a patient decides they want to go into the backyard or go down the street, something of that nature, if they want to remain mobile. So as a backup, what we provide is what you see here. A backup unit consists of a cart, a tank, usually an E-tank, although there are other sizes, a regulator that regulates the flow from the tank to the patient, and a nasal cannula or mask. The tank goes inside the cart like so, and next I will show you how to hook up the regulator and the nasal cannula. This is our backup unit. I'm going to show you how to connect the regulator to the bottle and how to turn it on so that the oxygen flows. This bottle on top, again, what you have is a toggle. This is the unit that you will turn to allow the oxygen to come out. On the front here you have a little red piece. This needs to be taken off first. When you take this flat piece off, you'll see that there is another round red piece with a hole in it. That should remain there. Will seal the unit and not allow for the oxygen to escape to the side. This is your regulator. Okay, the regulator has a T right here that turns and closes it onto the bottle. It has a gauge right here. The gauge, if you look at it right now, will show you that the arrow is pointed into the red area, which is 0, which would indicate there was no air in the tank. It was hooked up to the tank. When you hook it up to the tank and you turn the flow on to the regulator, with this one, what should happen is the arrow should go up and be into the green area where it indicates 2,000. This would indicate a full tank. 2,000 indicates a full tank. If the area was at the 1,000 level, that would be a half a tank. Inside the regulator here, you show these 2 pins on the bottom. You can see these 2 pins, and then on top of that there is a hole. On the bottle, right below the red washer, are 2 holes. So what you need to do is align the pins right here with the 2 holes, which means the pins are going to be on the bottom of the regulator. Okay, so we position the pins at the bottom. You need to then put the regulator over the tank and position those pins into the holes at the bottom. You will feel them go in. When you feel them go in, then push it towards the bottle so that the pins are locked in. Then the T here on the other side, turn it until the screw goes in to the bottle or adheres to the bottle, and make sure that it's tight. Okay. Now we have the regulator on top of the bottle. So the first thing we're going to do is we're going to check to make sure there are no leaks. So in order to do that, what we need to do is right here on the side there is a little knob, and you can turn that and that will set the flow. If you look at this little hole right here, you'll see that right now it's set at 2, 1.5, 1. It goes anywhere from 1/2 all the way to 8 liters per minute. So we're going to set that first at 0 to make sure that there's no leakage around this area. Set at 0, so we're going to turn this now counterclockwise. You don't have to turn it very far. That's far enough. Now as I've done that, and I'm looking here, I see that the arrow is now at 2,000, which indicates a full tank. I don't hear any leakage around here, so we're fine as far as it's now on the bottle perfectly. Now if we needed to use this, the first thing we would do is we would take our nasal cannula, remember the end that hooks up to the concentrator, and we would place that down here on this nipple that's down below the regulator. You just fit that on. Okay, we're opened up here, you know that because it's registering 2,000. So now we need to set this for the flow. We turn this knob to whatever flow we have set for the patient, which most of the time is 2 liters. So we're just going to turn this until we get to 2, and now we have flow going to the patient. So now you have to do is place the nasal cannula on the face or the mask as you normally would. Okay. Now to make this as easy as you to use in the home, what I always suggest is instead of turning both of these off, and remember that there's a limited amount of supply of oxygen in this tank. So when you're not using it, make sure that this is turned to the off position. So what we do is we turn this clockwise until we can't turn it anymore. When you do that, if you were to look at the gauge, you would see it slowly going down to 0. Okay? Once it gets, this lets you know that the air is contained in the tank. This way, if you need to use this tank again, there's only 2 things you need to do. You have the nasal cannula already hooked up, so you attach that to the patient. You go up to the knob up here, or to the toggle switch. You turn it counterclockwise. Don't have to turn it very far. You're ready to go. That's it. Again, make sure when you're not using it, you turn it off. You do not use humidification for this. This is used for mobility of the patient or in case of a power outage. Last part of the in-service I'll go over is some safety features as far as the tank goes. Okay, safety features as far as the tank goes, the backup tank. Number 1, you need to position this in a place where it's not going to get knocked over by children or dogs or anybody running through there. If a tank is knocked over like this and it hits against something hard and knocks the top off of this, it can become a missile, and you don't want that to happen in your house. So position it in a place that's out of the way, but in an area that is open, that's not closed. Never in a closet, never under bedding or any place like that. If the oxygen would escape from this and would go into bedding or something like that, it could saturate that area, and then a spark could cause it to become a huge problem. So we want to make sure that we get plenty of airflow around it. So please keep it in an area that's safe, that will keep it from getting knocked over. Keep it away again from any open flames. You don't want it next to anything that will create excessive heat. Keep it out of the way of dogs, of children, anything of that nature. Oxygen in a tank is a little more dangerous than it is in an oxygen concentrator, so you probably need to take a little bit more care. Make sure that it is turned off, that it is not continuing to run if you're storing it somewhere. Lastly, I hope this helped. If you have any questions or if you need to have anything answered, you can always call Montgomery Marketing at 562-777-7088. We'll be happy to help you through any needs that you may have.